This class is being sponsored by the IABDM, which is a very similar organization to the IAOMT. I'm actually a member of both. Matter of fact, most of our members are members of both organizations. We do have a few differences in that we also believe that fluoride is toxic. We believe in a safe mercury removal. We call our protocol the PROTECT protocol. We want to protect the patient, the staff, and the planet. And we have differing views about root canals and the toxicity of them. So we are going to share that with you today. That'll maybe be new information for some of you. And then we also believe in cavitations as well as meridians. So some of that may be new information for you today. Just keep an open mind. I remember very well the first time I heard some of this and I thought, oh my gosh, these people fell off another planet. Only to then be standing here talking to somebody else about it. So if I did fall off another planet, I'm about to take you there. I am Dawn Ewing. I'm the executive director of the IABDM. I started off in dentistry years ago as a dental hygienist. I love dental hygiene. I got really involved. I ended up serving on the state board in Texas for 2 terms. And then, I don't know what happened. I moved out to the country and got excited about EMS because there was an accident near my house. And I had just taken a first aid class. And I thought, ooh, big time, I'm getting to use my skills. Which ended up morphing into taking an EMT class, which then translated into taking a paramedic class. And then I went to work on a 911 ambulance, and then I did air ambulance around the world. So I really got involved in that world, only to then decide that there was a need for more prevention. And so I got involved in the world of naturopathic medicine, went back to school and became a naturopath, ended up with a PhD in integrative medicine, which only took me back to dentistry because a lot of people's problems stemmed from what was going on in their mouth. And so you're going to hear my version of that as I impart that to you today and give you a few little pearls about when you need to be networking with someone else besides the dentist in the office, like somebody who deals with diabetes or a naturopath that could help you. We also want to be all about staying safe. So every time I tell you something, I want to remind you to stay within your scope of practice, which is why you need to be networking with a team. So in the office where I am, we kind of have a door that disconnects the 2 offices, but we do all the naturopathic stuff in one wing of the office, and then all the dental stuff goes on in another part of the office so that the dentist can keep his license completely separate from all the weird and voodoo-y stuff that I do on my side. Okay. First off, I want to read a disclaimer here, make sure and get it on tape really good. I do not have any financial interest of a product in my talk or any companies offering grant monies for this continuing education, dental, medical education program. And that goes ditto for the other 2 speakers that will be coming up today. This is not a I'm smarter than anybody else. Oh, let me stop for a second and introduce Toby. Oh, okay. Right. There's an office here. If you could just give them one so they could follow through on a syllabus, that would be nice. Right here, I don't care about the others. Okay.
I have two without syllabuses. I have 1, 2, 3, 4.
If you do not have a syllabus, would you please raise your hand? I can't take care of everybody, so if you guys are in office, if you could have one between the office, that would be helpful. I really just have a couple. Okay. Great. Thanks, Tobe. Okay. Again, this is not we are smarter than you are right now. I remember me sitting talking to patients about 50 reasons why they needed to have a root canal and not have a tooth taken out, and how the bite would shift, and basically they wouldn't be able to eat and they'd die early. And I now do just the opposite and give them 50 reasons why having a root canal compromises their immune system and why they might be looking at some other options. So it's just that stuff changes. You know, I remember the first time that I heard information that wasn't the way I heard it in school the first time. And I thought, wait a minute, why didn't my professor tell me that? Only to be in a university setting where I was teaching, and they came in to audit one of my classes, and they said, Dawn, you can't tell them that kind of information. That's not what's in the textbook. And I said, well, my gosh, stuff changes. You know, the new information that's out there is not in print yet. And so I'm trying to give them stuff that's peer reviewed, and it's real science, but it's not in textbooks yet. You're right. Nope, you can't do that. You have to teach what's in the textbook. So I made my students take tests on what was in the textbook, but then they had to write papers on what was the for real, because in science stuff changes quickly. So our goal is for you just to have an open mind and not think that all the stuff that I'm saying is too off the edge weird, and just bear with me. And as time goes by, you might hear things over and over again, and you too might believe like I do. So our mission as the IABDM, we believe in everything that is taught in your traditional school. We just take it to a different level. So it might be a little different than what you originally learned. We hopefully today will impart all kinds of information, even at the basic level of record keeping, which Dr. Margolis will be covering today. So our definition of biological dentistry is that it involves the entire body. We think of things like the dental materials and the techniques and procedures. We even take into the emotional aspect of what's going on for a person. If they're losing a front tooth, that might be too emotional for them at that moment in time. For us, bios is the root word of biological. It means life, and all the rest is just logical to us. So how is biological dentistry different? Well, we don't use amalgams. We use composites or porcelain fillings instead. We do practice safe mercury removal. This is a big deal for me. When a patient calls the IABDM and they say, I'm looking for a mercury-free dentist, we stop them right there. No, you are not looking for a mercury-free dentist. Mercury-free means that that office chooses not to place amalgam fillings. You are looking for a mercury-safe office, and we explain to them what it is they're looking for, and then help them get connected with somebody who can provide that service for them. We believe in testing the individual for the materials that they're going to have put in their body. We don't use fluoride in the office, and those are just a few things that make us unique to dentistry. I do want to make sure that you leave today with a few names that you've at least heard before. Weston Price is one of them, who's a dentist from Ohio, and he got very involved with some of his friends were doing missionary work and coming back with pictures, as you can see down in the lower part of the screen, nice wide arches, not a lot of decay. So he ended up going and looking at these individuals and finding out that people had different diets in different parts of the world, and then when they adhered to that and they didn't have sugar in their diet, they really didn't have decay, and that they had nice wide arches. Once sugar was brought into the picture, then their development started to stunt, and their offspring then started to have smaller arches and crooked teeth and a gross change in the decay rate. When he got there the first time, one of the comments that he made were, I found 3 people that had decay in their mouth. Now they had green teeth, but they didn't have decay. You know, you don't find that here in the United States. Our diet is not such that, what we do, we promote decay. But he wrote textbooks on nutrition as it applies to dentistry. So he's a big name. I would strongly suggest that you get involved with the Weston Price Foundation. A great thing for you to do is to get your networking group and invite them to come into your office, so that when somebody's on the phone with your receptionist and they say that they're a member of the Weston Price foundation, you already understand their languaging and you know what they're about. Because that's just going to be a good networking for your practice to bring more people in. We do believe that you need to know about diets. And there's a bunch of diets out there. There's a paleo diet, and there's the South Beach diet and an Atkins diet. Everybody has a diet plan. But if someone is calling your office or you're speaking to them in the chair and they say that they're doing Gerson therapy, that should automatically trigger in your mind that you recognize this is a cancer patient and that they're going to be juicing and that they might have to get up during their appointment in an effort to be able to keep with their schedule of juicing. I don't expect that you know everything about it, but I'm hoping that these are things that are going to make your office friendlier to these kinds of people that are coming in. Because we do things differently, we have to document it. If you didn't write it down, you didn't do it. So I want to introduce Dr. Mike Margolis, who is probably the leading authority in record keeping, only because he's taken so many classes on it.
And given.
Yeah.
It doesn't matter. I'll tell you why in a second.
All right.
You gotta unhook the one. I don't know where that goes, so I'm not touching it.
It's on my butt.
Like I said, it's on her butt, I'm not touching.
There you go.
The other way around is fine.
You got another ear?
I got two ears. If you can hear me. Okay. Okay. Good morning. We're supposed to say that we have no financial tie to what we're presenting today. This is the IABDM. And no, I don't have any financial things going into it. Please understand that regardless of how good your records are, it doesn't matter if people on a board are against biological dentists, they'll find something. But you have to lay foundation. Foundation is something that I learned from my wife, who's an attorney. That tells me that you need to make sure that you have all your bases covered and put things in your records and make sure everybody signs everything. And so cross your T's and dot your I's. And I'm not talking to the doctors, I'm talking to the assistants. Because I had a case with the state board where a woman had surgery 3 times. And on the back page, she signed her name 3 times. She put the original date. She didn't date the second one. And then she dated the third one and put the second date. Never did the second date. She did it as the third date. But we're pretty efficient, and we had a piece of paper with the treatment plan for that day. And on the bottom of the page, it said, I give my consent to have Dr. Margolis, or a representative of his office, to do this, consent to the treatment. And the consultant for the board said, well, that's not good enough. If we were in a court of law, that had been more than good. And we'll find out about that in another month. So, you got to make sure that when a patient comes in, each line, you want something that you can peel off and put on your router or whatever piece of paper there is. No information has to show up on that sheet. So where do you get these forms? Well, let's take a look. Oh, it didn't transfer. Didn't transfer on here. Okay, I don't know which slide for this presentation. I put 3 extra slides in here this morning. There is one, the old-fashioned one, you used to just have a sign-in sheet and everybody was there. Medical Arts has it that you peel off the name and it goes on your paperwork, and that way nobody can see it. And then at the end of the day, you take off the last sheet, and then for your records, you have to have these daily sheets. We were called into court for a divorce case, and we had to prove that that patient showed up. And all we had to do was show that they had the sign-in sheet. So it all worked out very, very well. For women taking birth control pills, it's kind of important that if you put them on antibiotics, you have to discuss the effects, because it could disable the birth control pills from working. Bisphosphonate drugs. How many people here do surgery? Okay. The only time I've ever recommended a root canal other than somebody being in hospice and going to die in a few days, was when the patient was on bisphosphonate drugs. Do not touch these patients unless you're just doing restorative. Because if you take that tooth out, they may not heal. They just don't get better. And so send them to your friendly oral surgeon. Let them have the headache. They have access to the hospital. But most patients do not know what that drug does. A very dear friend of ours from Canada came in, and she's got teeth that are class 3 motion. And I won't touch her because they gave her bisphosphonate drugs injected. And she says, oh, it's just wonderful. But nobody ever told them what the other side effects. And side effects of the drug doesn't mean it's a side effect. It's truly what the drug does. And so many drugs will affect the oral cavity and will reduce saliva, create anemia, reduce your CoQ10 and more. So, and also know if your patient's pregnant. So the sign-in sheet, oh, it did come in. Here's the old-fashioned one. Here's what I was talking about, peels off. And then over here, at the end of the day, you got a carbon copy. And that's their handwriting. So in court, it's a little hard for somebody to say that's not their handwriting, or the other person saying that. Is it written in the chart? If it's not written in the chart, it didn't happen. There's no way in heaven that you're going to be able to write everything in the chart. I have a friend up in Utah. He records all his surgeries. He shows the stuff that's coming out. And if you really want to have something going on, you got to make sure that everything is documented and the patient signs it. One of the most important things that you do is you ask the patient questions like what's going on with your, whoop, I just went blank. Oh, with, Dawn, I just forgot what I was going to say. It's all that mercury I've been taking out lately. I'm sorry. And I do wear all the protective stuff. I apologize. So is it written in the chart? If it's not, forget it. Also, many times what I'll do with the patient is I'll ask the patient to sign the chart. If there's something that's gone wrong or whatever, they've been informed, I have them sign the chart. And how many times have you done a restoration and you've pulped a tooth without realizing that was going to happen? Because sometimes you get a thin pulp horn. You tell the patient what's happened right away and you have them sign the chart. So that's where it goes. Am I doing fluoride or is Marianne doing fluoride? Okay. So we're going to move on and talk a little bit about fluoride. How many people think fluoride's a wonderful thing? Not one hand? I was in dental school, every hand went up. You know why? Because we were told it was wonderful. So why are our public water systems fluoridated? It's called money. At the core of the greatest fortunes in our nation, Alcoa, U.S. Steel, Atomic Energy and the automobile companies, the Mellon Company family, the DuPont, the General Motors. It's used in smelting of aluminum. The Manhattan Project. Now, I'm old, but how many people know what the Manhattan Project is? Doing better. Manhattan Project was the development of the atomic bomb. And in New Jersey, at the plants in DuPont, they were processing uranium with fluoride, and the shoes of the workers, the nails were melting out of the bottom of the shoes. People became very ill. The crops in the area didn't produce anymore, and the animals that were being born were born with 5 legs or many toes. So it was for the world effort against the Nazis and the Japanese. Then serum gas, rat poisoning. Yeah, it's one of the main ingredients in rat poisoning and used in flavoring of children's toothpaste. Isn't that wonderful? Claiming to prevent cavities. So the smelting reduces the temperature at which the metals flow with fluoride. So there's case after case. In 1907 in Germany, smoke poisoned the cattle. General Motors patented lead as a gas additive. How many people want to breathe lead as a waste product into the air from burning your gasoline? Frigidant in your refrigerator, you needed fluoride. Belgium, Valley worst industrial air pollution, 60 people died. And it just goes on and on talking about wonderful things of fluoride, how it sponsored scientists promoting fluoride use in dentistry, linking it to better teeth, insisting lower doses had no health effect whatsoever. And the father of spin, Bernays, was phenomenal at the birth of public relations. And Dr. Hodge. This should be a name that everybody in this room should learn to dislike. The nation's leading fluoride researcher who trained generations of dental schools as a senior toxicologist for the Manhattan Project. You had billions of dollars worth of fluoride in a toxic form. What's the most brilliant thing you can do? Pass it off as a health benefit to the American public. Distribution of an elemental fluoride is widespread throughout nature with a small intake of the element is practically unavoidable. Fluorides in general are a protoplasmic poison, probably because of their capacity to modify the metabolism of the cells by changing the permeability of the cell membrane and by inhibiting certain enzyme systems. The exact mechanism we don't really know. Okay, we went back. It's all right, we'll get back to Dawn. Come on back, Space. Okay. So, what part per million of fluoride compounds used in insecticides for fruits, vegetables, and mining? Phosphate rock, superphosphates, fertilizer, mercury. The fluoride contained of phosphate rock is about 4%. What did 4% do to you in your diet? During a conversation of superfluorides, about 25% of the fluoride present volatilizes and represents pouring into the atmosphere approximately only 25,000 tons of pure fluorine annually. Another source of fluorine intoxication is from the fluorides used in the smelting of many metals and everything else. So, drinking water. This used to be even higher than 1.2 parts per million would cause developmental disturbances. But back in the American Dental Association editorial in 1944, they recognized we can't run the risk of producing such serious systemic disturbances. The potentiality of harm outweighs those of good. So what we know today could be wrong later. Fluoride increases bone fractures, interfere with brain function, increase osteosarcoma, decreases thyroid function, affects reproduction, causes birth defects, and affects your immune system. But other than that, it's made a lot of people very rich. Back to Dawn.
Okay, so a biological office, it's mercury. Your patients that come in that are mercury toxic are very sensitive to smells. This is where, I can't get that to go on. This is where patients will come in, they're super sensitive to perfumes, the smell of gasoline drives them crazy. Those people usually have higher levels of candida. As they get healthier and get their candida reduced, they seem to do better with some of the smells. But if you could just make your office fragrance-free, that would help a lot. And you have to think about things like, in our office we don't use any hairsprays or hair gels that smell or lotions that smell. Now some biological offices are into essential oils. I can't even tolerate essential oils. There's a few that I can stand to be around. One of them is thieves, but I don't do very well with the oils. I'm sorry, this is not doing right for me. No. I can just get it where it's not slipping. Okay. Tongue diagnosis. Now, I'm not saying that you're going to be diagnosing every illness that person has, but you're going to start paying attention to things like their tongue. You might even print out a chart and put it in the room so that the patient knows that you're looking at things different than a regular office is. Your office is going above the call. So you are looking at the back of their throat like you do for your head and neck exam, but you're noticing things like, is the tip of their tongue bright red? Because that might mean that there's some heart issue going on. It's not a diagnosis, it's for you to just make note that maybe you need to be asking different questions or refer them out. The sides of the tongue, are they really scalloped? There's great books. There's tons of information online. You can even take little courses that are online that are about tongue diagnosis. Another great thing for your office to do, and I'm trying to give you things that your office will do that will set you apart from a traditional office. The traditional office has their place, but these people are coming to you because you have different skill sets. This is a particular thing that I am very passionate about. The dental DNA, oral DNA tests are available to help with HPV virus. It gives you a whole host of different things to look at whether the person is interleukin-1 positive. Those are the individuals that when you put braces on them or you put a titanium implant in, they end up with implantitis, or you've seen gums that swell up and the person has good home care, but they just can't tolerate something that's not self in their body. And so that's useful information to have on the front side. They also have some tests that have to do with specific bacteria that relate to periodontal disease and cardiovascular disease. So what if the person coming to your office could be getting a checkup, kind of like getting information about their heart, simply by getting their teeth cleaned and seeing the dental hygienist? So if they came in and you saw a perio issue, you might be doing this test, the oral DNA test. If the AA or PG came back, those two are very tightly connected with cardiovascular disease. This particular test, and this is what some of the results can look like. I was in a conference years ago, and it was a rheumatologist that was lecturing. And I'm going to try to relay the story that he told, because to me it really, a light bulb went off. It was a little girl that came in, and I think she was somewhere around 4 or 5 years old. I'm not sure that I remember exactly. But she had acute onset of juvenile arthritis, and she was in a lot of pain. So family took her in. They did a workup, and they said, yeah, okay, that's what you have, juvenile arthritis. So that means that she is destined to a life being on steroids, basically for the rest of her life. And so this guy said, wait, before we do that, I'm going to think outside of the box. I'm going to send you to a dentist, and I'm going to get her tested. Well, they don't usually do this test on kids, but they did. And it came back where the AA was just like really sky high. And so he said, well, okay, now we need to test the parents, because she probably got it from the parents. But they came back with a really low. And so he said, wow, I'm confused. I don't know where she would have gotten this. It's usually found in periodontal disease, and I would have thought it would have been the parents. And the mom said, oh, my mom takes care of her during the work week. Oh, well, let's check grandma. Well, grandma had a really high AA. So what they did, although it was conventional treatment, they put the little girl on Augmentin, which then took care of this particular bacteria that was causing a problem for her. And all her symptoms of the juvenile arthritis went away. So it doesn't mean that she's not going to get it in life. It just means that she needs to not eat after grandma, because grandma's got a perio issue that she needs to address. But it's those types of things, thinking outside of the box, that we're talking about a biological office being able to provide. Okay, so now you're going to see me take off my naturopath hat, and I'm going to put my hygiene hat on, because in the office, even though I'm seeing people and I'm talking to them about their blood work, and they've already been diagnosed with cancer or arthritis or whatever else, I usually end up talking to them about how they're taking care of their teeth, which seems very odd, but it really plays into a lot of their health problems. So I know that people hate to floss. I know that they can't stand it. I talked to a group of nurses, and they were the Holistic Nursing Association in Houston, where I'm from, and I asked how many of the nurses floss, and very few hands went up. And then I asked them if they ever flossed their patient's teeth, and nobody's hand went up. But flossing is really, really important. So I created this next slide for them. I said, okay, if you're not going to floss, then you might as well just select any one of these dishes and put your lunch in it and eat it. Because for me, it's just that gross that you would eat on teeth that are dirty, just like eating on dishes that are dirty. But that's the hygienist in me coming out. Most people don't think that way. I completely get that. But I went into their world and said, if you saw a wound like this, what would you do? And of course, they started giving me all kinds of answers about how they would debride the wound and take care of it on a daily basis and how important keeping it clean is. But they don't get that in a mouth. And so your patient that's diabetic is going to be having problems keeping their blood sugar stable if they've got a gum infection going on. One of the things that you could do to set your office apart is find some place to volunteer, a nursing home. Get in with the hospital and ask to go into an ICU unit and just brush people's teeth. What an impact you would make with just the population in your area if you would go out and do something like that. Well, we all know that healthy gums don't bleed, but your patients don't know that. If they've had their gums bleeding every single day, they just think that that's normal for them. So you have to look for ways to talk to them about what normal is and what normal is not. And so when I talk to them about washing their hands, I say, now if you washed your hands and you started seeing blood coming from your cuticles, would that be healthy? Oh no, that's not good. Well, it's not good if you see pink when you spit either. You know, the AIAOMT, which is another whole organization, they have a tagline that says 0 tolerance for bleeding gums. And I really like that tagline. And so I've tried to impart that to my patients as well. If you spit and there's pink, you need to be calling my office. And so you should do the same thing. I try to explain to patients that your teeth are separate organs. So your teeth have their own blood supply, their own lymphatics, their own nerve innervation. Do you realize that when you brush your teeth at night and you run your tongue over your teeth, they feel so nice and slick. What do they feel like when you get up the next morning? They are so gross. It's like slime in the ice machine. If you've ever cleaned a fish tank before and you've got that slime that builds up on the glass and on the tubing, that's the biofilm. A healthy tooth, Loma Linda has shown us this with research, a healthy tooth pushes its waste product out through the tubules to the outside of the surface of the tooth. That's the biofilm. An unhealthy tooth takes in the waste into the inside of the tooth. So when you brush your teeth at night and you wake up the next morning, that's tooth poop, which is why you need to get up and brush your teeth again, and that's why your mouth smells like shit, because that's what it is. So once my patients get that, then they're more prone to, oh, okay, I guess I need to brush my teeth in the morning too. Yes, that would be a really good idea. Oftentimes they'll ask me, what kind of toothpaste do I need to use? You know, you don't need to use toothpaste at all. A dry brush, the mechanical action of the brush and the action of the floss will get everything off. And so in order to explain that to them, I say, you know, if it was the toothpaste that was working to clean your tooth, we would encourage you to smear toothpaste in between your teeth when you got ready to floss, so you would be working that toothpaste in between each tooth. It's just the mechanical action of the toothbrush, and actually the toothpaste sometimes works against some of these people. They brush, my mouth tastes good. Okay, they spit, they're on their way. No, they didn't do a good job brushing at all. So if they'll use a dry brush and go over all their teeth with the dry brush, and then take their tongue and run it over, and if they feel any place that's rough or fuzzy, go back over that area. That will help them have better hygiene. So I speak in a lot of word pictures. You know, part of the reason that I'm do what I do now is because I became mercury toxic and I didn't even know it. I didn't have any symptoms or anything that I could pin like you talk to a lot of people that do. I've always been ditzy, so it just didn't seem like there was any problem with me. I gave birth to a son that is high-functioning Asperger's. And so that made me start looking at where in the world did he get this level of mercury, and of course he got it from me. So it changed everything in what I was doing as far as trying to get away from my exposure to mercury, and then I found out I was MTHFR positive, which we're going to be going into as well. And so all of that played into my mercury toxicity. You're going to have patients that come in that don't even know what they have wrong with them, but focusing on the basics is what we want to do. So when we're talking about just brushing and flossing, that's the heart of everything. So there isn't anybody that couldn't do with a little bit of tweaking. A biological office does know more about prescription drugs. When your patient comes in and they start listing off what they're on, I want certain things to trigger. I would love for you to take the time like I do to just simply get a little book that says it's about depletions, and you look up each of the drugs that they're on, and it'll give a list of things that get pulled out, whether it's folic acid or iron or CoQ, and just help them figure out maybe what they need to be on, and then again get them networked with somebody. So you might have a chiropractor in the area that's really good with nutrition, or a DO, or an acupuncturist. There really needs to be some group of individuals that you network with. Again, the bisphosphonates are known now to contribute to jawbone osteonecrosis. That's, in the very beginning, there were hints about that. Now it's a known fact. These are some of the drugs that you might have listed. So maybe you want to take this page and you want to ask every patient as they come in over the next year, are you on any of these? We're just running a poll and trying to figure out what patients are on and make them aware that this could cause a problem for them. Proton pump inhibitors. How many of your patients are taking something for suppressing their hydrochloric acid, being told that they have GERD or reflux, when in fact they're low in hydrochloric acid, or they're achlorhydric, they don't even make hydrochloric acid. This is one of the most common things that people are on, and it's known to pull out CoQ10, which interferes with not only heart tissue, but it interferes with your periodontal tissue. So everything you're going to do is in the name of perio. Everything. There isn't anything that I couldn't come up with that I couldn't find a way to get it back to your perio condition. You've got a pocket here, and that's the reason why I am suggesting you use the CoQ10. You happen to be on a prescription that pulls that out, but I'm seeing a change right here, and that's when you want to write it in your record why you recommended that particular supplement. Long-term taking the NSAIDs for anti-inflammatory. Somebody comes in and they tell you, oh gosh, I've got problems with joints, and so they've been taking NSAIDs for a long time. All those types of things have a price to pay. In this case, it pulls out folate. And so, we just want to document it and make a suggestion. It should be common knowledge for you about things like dilantin. Who didn't learn that in school and see pictures of the hypertrophy? But we don't think about things like antihistamines. In Houston, I don't even know who doesn't take either something homeopathic, but we've got horrible allergies in Houston, seasonal allergies, people that come through. It dries out the oral mucosa, coupled with the fact if you've got a mouth breather because they don't have a good airway, which is just another level of doing biological dentistry. So what if they have pretty teeth but they snore at night and they end up dying early from sleep apnea? So all of that plays into the biological office. Here it plays into even rampant decay if we've got someone who's a mouth breather. Just another reason why they may need to be in some type of an appliance from your office. We've got high cholesterol. So our patients that are on statins, we want to document that they're on it, and again suggest the CoQ. I want to go into anemia a little bit because I think that it's really important as it plays into delivering oxygen to tissues and good tissue perfusion. And a lot of patients are taking things that deplete something that can create anemia. So that's your reason for looking at anemia. But your patients think anemia is only iron anemia. Well, that's just not true. So I want to try to explain the difference between the types of anemia. And this is the analogy that I use, or the word picture that I use. I tell the patient, you need to bring 100 people to my office tomorrow, but I am not going to tell you why. And you go home and you think, that Dawn, she's so creative. I know she's going to do something. She's probably going to shoot a video. You know, I'm going to swing by my local church and I'm going to pick up 10 little infants and 10 toddlers, and I'm going to go by the nursing home and I'm going to get 10 geriatric patients, and then I'm going to come in with a bunch of friends. So I've got the 100 people. And you show up and I look at you, go, are you serious? We're going to build a house for Habitat for Humanity. What the heck am I going to do with all these little infants and toddlers and these geriatrics? I have to take 10 able-bodied people in order to watch all of them. What were you thinking? And you're, oh gosh, I'm sorry. Yesterday, I went out to Lowe's and I got tools because in my mind, I was going to divide the 100 people into 2 groups. 50 were going to work with hammers. Well, how's a hammer work? You can't share a hammer. Everybody has to have their own. And you have to have more than one nail. This group was going to get screwdrivers. Same principle. You can't share a screwdriver. Everybody's got to have their own to work with, and you've got to have more than one screw. Well, in this case, the iron are the people. So you could be short in people, and that would be iron anemia. But what if you came with 150? You'd have too many. I wouldn't have enough tools for you. So the tools are coenzymes or cofactors that make the iron work. You can have B6 anemia. You can have copper anemia, you can have vitamin C anemia, you can have B12 anemia, you can have folic acid anemia. Those are the things that make the iron work. So a lot of times when my patients come in and I'm going, oh, you're anemic, but it's not iron anemia. Matter of fact, your iron is too high. So your body is actually toxic from iron, but you're still anemic. So once I explain this story to them, they kind of get the picture a little bit more. Folic acid and B12, for me, should be in every dental office. You know, you can over-methylate the patient, so you don't want to put them on a super high dose. And if by some chance you did over-methylate them, you could just ask them to take some niacin, and it would work it out real quickly. You'll know if they get over-methylated because they get really angry. I mean, like, hit angry. I've only over-methylated somebody one time, and it was an elder woman. And the family called to say, you know, we're going to have to put her in an institution because she's just combative and she's hitting us. And a light bulb went off, and I said, oh my gosh, put her on some niacin right away and let's see. But I had put her on some cream because her digestion was so poor, I didn't think she'd be able to get the B12 in. And so I put her on a full dose, which I shouldn't have. I should have put her on a half dose because it really did absorb. So when we're looking at the MTHFR, the methylene tetrahydrofolate reductase, these are the individuals that either, one part of the flaw is that they can't get B12 out of the red meat that they eat. Or the other part is the part that I have. I don't possess the enzymes to break down folic acid. So 23 years ago when I was trying to get pregnant, silly me, not knowing about what was going to happen in my life, I actually wanted to get pregnant. I went to my doctor and he said, well, you know, you need to be on folic acid because it reduces the risk of spina bifida. So let's put you on 800 micrograms of folic acid every day. Nobody knew at that time that I couldn't break down folic acid. It built up to toxic levels. I have no idea how that played into it. But because I could not methylate mercury, every exposure I was being exposed to, every exposure, my vaccinations when I was little, my time at the dental school, my time working as a dental assistant, my time working as a dental hygienist, working in an office that had mercury, the times that I played with mercury in my hand. How stupid is that? But I did it. Everybody did it when you were my age. Way back then, we didn't realize that it was toxic. All of those exposures just built and built and built. So in my patients, I call those individuals hoarders. We've got people that excrete mercury, their body functions the way it's supposed to, and then you've got those that hoard it, thinking they're going to need it at some point in time, so they stuff it all over their body and they don't methylate the mercury out correctly. Those individuals need to be placed on a special kind of B12. The methyl form is traditionally the one, but now that we have 23andMe, believe it or not, I'm finding some people don't do well with the methyl form either, and we have to give them a different form. But the one we want them to stay away from is the cyanocobalamin. And so if they tell me they're taking vitamins, I write down cyano and I say, go home, and if your B12 says it's cyanocobalamin, then stop taking it, and we're going to put you on a different kind of vitamin. This form you can get from SpectraCell. It's a great thing for you to have in your office that just gives more information about methylation and gets them understanding that you are the office for them to come to, because your patients come in and they are so educated about stuff that as soon as I tell somebody, you know, I have an MTHFR flaw, or I'm looking at their blood work and I go, oh, are you MTHFR positive? They know. And they are so excited that there is somebody who gets that, so that they know that they're going to have the protection that they need in order to be dealt with safely. Low vitamin B12 in the elderly is super common, but it's also common in kids that have ADD, ADHD. It plays into all of that. It's now when I've got patients that come in and they have the beginning of dementia, although there's a gajillion other things I could be thinking of, my first go-to is, are they MTHFR positive? Could they be low in B12? And do they have heavy metals? And so all my protocol is set up to make sure that we can do heavy metal testing on them to rule out that they've got issues like that. Because some of these people that come in and they've got non-Parkinson tremors, you know, they're holding their hand out like this, or they're trying to fill out paperwork and their hand is shaking. For me, my first go-to is heavy metals. So the inflammation is seen all over the body. For me, I do thermography in my office as well. And so when I am doing thermography on somebody and I see that they light up like a Christmas tree all over the place, that already for me is a marker that they probably have MTHFR. So we'll get it ruled out. This is just another little pearl of information. You don't want to share all your pearls at one time. You want to like distribute them throughout the year. I find what happens is my patients come in and they say, what's new? And you want to be able to have something that's what's new, maybe up front in a little plexiglass. So this could be one of those what's new. You know, you find the Dirty Dozen online and the Clean 15, and you turn them on to that. But then the pearl is a little further down. When you're looking at the barcodes that are on all your fresh fruits and vegetables, the conventional produce uses a 4-digit code. So the example here I have is 4139. Organic has a 5-digit code, but they try to trick you because the GMO also has a 5-digit code, but it starts with an 8. And so, you know, years ago patients would come in and not many people were eating organic, but now a high majority of the people coming in are paying attention and trying to eat cleaner. So this is just a little pearl to pass on to them. Probiotics, a couple of great kinds that are awesome for oral cavity. The probiotics can be used for different things in your body. When we're looking at taking probiotics, most of us think about our gut health, and your mouth is just the beginning of the gut, so it's important that we take care of it. But we're looking for the Streptococcus salivarius. It's a good probiotic for the mouth. Part of what it does, and so a lot of times I like the ones that are lozenges that kind of sit in the mouth, or I'll have someone open up the capsule and put it in a little bit of water and swish it around. It kind of gets in the crevice of the gum tissue and seeps down into the sulcus and creates its own hydrogen peroxide. That's basically summarizing what it's doing. And so I explained to the patient, if you've ever lived in the country before, you have a septic system. And in that septic system, every once in a while you have to put Rid-X, which is good bugs down in the bacteria to eat all the stuff that's in there. We have to do that in our body as well. But there are particular brands. These are a couple. I'm not promoting these 2 brands. I'm just telling you there are some out there that are specific for dental offices. And that's the kind that I think would be better suited for you. Diabetics. And of course, now we've got a diabetic and amongst our speakers. I'll let you figure out who that is. But you're going to find more diabetics in your office. Actually, that is the issue I find most often on people where I'm going, oh my gosh, when did you become a diabetic? I'm not diabetic. Okay, but you meet all the markers for it. I tell you what, I'm going to turf you over to your MD and I'm going to have them look at this and tell you that you're not a diabetic. And generally they come back, how did you know? Because I was looking at the numbers. So when you're looking at somebody's mouth and you see wounds are not healing, you see perio issues, and we'll get into microscope in just a little bit, but there are a lot of undiagnosed diabetics out there. A healthy hemoglobin A1C, and you know you can get these test kits now and you could have this in your office and there is no reason that you could not provide this service for a patient in the office if you're suspicious. But you would like it to be 5.7 or less, and you're going to be shocked. Just offer it for patients. I think you can get, I got my most recent kit. I just bought one for Toby because I was just curious, and on my way home I stopped at a CVS. I think I spent $40 for it, and there were two uses in there. So $20 each. You could charge a patient the $20. You could get them online and buy them in bulk, and I know they're a lot less because I've had them in my office before. But if your patient comes back and it's too high, immediately you would document it and you would refer them out. You want to, even if they don't go to their doctor, you want to make sure that you documented that you found their hemoglobin AC was too high. The hemoglobin A1C is looking at the amount of sugar that's coated on the outside of a red blood cell over a 120-day period. So my patients know me and they know how to cheat the system. So several days before they're going to go get blood drawn, they're staying away from their cookies and their ice cream and their sodas. And so they come in and their first morning glucose is, 92, 94. It looks really good. Their cholesterol is good. Their triglycerides are good. I've got a few little markers here and there, but then their hemoglobin A1C comes back 6. And I'm going, no, you just cheated for this last test. You've not been good over the long haul. So it's a way to check up on your patients. Your patients that are diabetic, your question should be, what was your last hemoglobin A1C? And document that in the chart. Just flossing alone. Again, I get back to, somebody comes in and they say, look, I have known diabetes and I'm trying to use some more natural alternative means. I'd like to get off my glucophage. And I explained to them, I'm not sure you'll be able to, but we'll see what we can do. One of the first things I asked them is, how do you take care of your teeth? When was your last dental visit? When did you get your teeth cleaned last? Give me information back from your hygiene. I want to see your pocket charting. And they're going, oh my gosh, seriously, I have homework? Yes. But showing them how to floss is really important. A lot of people are told to floss, but they aren't shown how to floss. They don't understand that when they go up in between a space, they are not just trying to get out a piece of meat. They don't get the picture that there are 2 windows of teeth there that they need to scrape up and down. So I like to give them word pictures about how to take care of that. So one of them is, you're driving your car and a bird flies over and poops on your windshield. Would you just make your windshield wiper go back and forth one time? No, because you would smear all that bird poop and you wouldn't be able to see through the window. You'd have to make it go back and forth and back and forth. So the similar thing when I'm showing them flossing is you floss and you push towards one tooth and you scrape up and down and up and down and up and down until you hear that squeak. And when you hear that squeak with unwaxed floss, you know that that area is clean. Then you move to the other tooth in that same space and you have to go through the same process. That is different than just telling them they need to floss in between each of their teeth. If you take the time to show them, sometimes it makes a difference. Does it always? No. The other thing is to show them how to hold the floss and how to move the floss. Some patients can't fit their fingers in their mouth, and so they use the little flossers. I have a family member that uses the flosser that will remain unnamed at this point. Those little flossers, to me, they're helpful, but I don't really understand using the same little piece of floss to push bacteria in between every space. So for me, it's kind of like, yes, my unnamed member. For me, it's like using one square of toilet paper over and over and over again. I just don't get that. I want to use a clean piece of floss in between each of those teeth as I go through there. But those individuals, you will see a drop in their blood sugar just by taking care of their mouth. The diabetes itself causes changes in the blood vessels. You think about what's going on inflammation-wise. I had a patient recently that just had some bypass work done, and in surgery they said, you have to be diabetic, because you've got so much inflammation in the inside of the blood vessels. And so although we had been documenting some blood sugar issues, we really didn't see any diabetes. And her hemoglobin A1C was 5.4. But she does have some inflammation stuff going on with her MTHFR. When you're looking at those blood sugar swings, it causes problems for the eyes, it causes problems for the kidneys, it causes problems for circulation. So when I'm doing thermography and I am taking pictures of feet and they don't have feet, they're just not there, they're not documentable, those are usually people that either have heavy metals or severe blood sugar swings. That is what happens to somebody's feet that's diabetic. So it creates problems for them all over their body, which is why it's so important that your diabetics chart needs to be flagged differently than everybody else. And you ask them all the questions we just went over. They've got poor circulation to the gum tissue. They have increased bacteria because of the blood sugar levels being so high. It's just a vicious circle where that blood sugar is perpetuated by bacteria, and the bacteria makes the blood sugar higher, and they are more prone to infections. You also will hear some claims of neuropathy, usually in fingers and toes. Some patients will come in and tell you that they have numbness in their tongue as well. Oh, my favorite part, the microscope. I just love the microscope. Are there offices here that have a microscope in your office? Lucky guys. It's just too much fun. You've got your good bugs that you can document, and then you've got your bad bugs that you can show. So when you're looking at your healthy slide, you're able to look at the red blood cell and kind of look at the shape and see that it's nice and round. And you look at your gum cell and you point it out to your patient. Say, look, this is a healthy gum cell. That's part of the reason why I've got you brushing your gums, so that you can desquamate all this dead tissue off. Here's the nucleus of a cell. Just point out a few things to them so that they become invested in looking at it. And then you point out some of the bad things that are in there. So this is a little video that I took of an amoeba. You see how it just goes blub, 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 blub? And then it's going to do it again. Keep watching it. It's just going to go blub, 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 blub. It just morphs out. Once you've seen one of these, then if you're looking at the slide and you think, oh, I think that's oh, look at there, it changed. Okay, that's an amoeba. That's not supposed to be in somebody's mouth. And so you're going to have to deal with this individual. To me, that's just so cool. Okay, here's the next one, and hopefully this will do like it's supposed to. You see this little guy kind of in the center that's sticking his tongue out, going like this? It's a trichomonads. It's not supposed to be found in the mouth either. This is your patient that comes in that when you can spray air on the gum tissue, you see bleeding. You see a lot of spirochetes in there. This is usually found in the vaginal area. So I didn't ask this person where they'd been or what they'd been up to. We just help them deal with it. Okay, so will I get in trouble using a microscope? Yes, if you say things like, I see cancer cells or I see candida, don't say that. If the person has eaten something that is a grain, it will look very similar to candida. Just stay away from all of that. Don't try to diagnose off of it. I actually have like a little sheet that I developed for the hygienist that's next door, and said, these are the bacteria that you and I just saw on the microscope today. Let's see if we can find them next time or not. Our hope is that we don't. But stick to the dentistry when you're looking at the bugs that are in there. Don't get yourself in trouble. You will see cool things, though. I mean, when you see the rouleau or the red blood cells clumping and somebody tells you what that means, and you put them on a digestive enzyme and then they come back and you see them bouncing off of each other instead of all coining together, that's cool, but that's not what you're supposed to be doing in the world of dentistry. Well, here's what I do. Well, when we actually teach this class in our office, and we do things like a lot of hands-on for different things, but I take a mirror and I kind of milk under the tongue so that I get some clean saliva onto the slide, because if you try to use anything else other than saliva, the osmotic pressure is different and the cells just explode and lyse and you don't get to see them. So I want to see them in their natural environment. So I tap that on the slide, and then I take an explorer or a scaler and I go around a tooth down deep in the sulcus. I would like to get a drop of blood because I want to see the blood cells. I want to take advantage of that so that you can see that if the white blood cells are actually undergoing phagocytosis, or if they're just sitting there not doing anything, that lets me know about their immune system. And then I mix all that together really good on the slide so it's not thick. and then I put the cover on top and I push it down really hard. Okay, then you want to treat and retest. So you might want to use ozone in your office, or ozonated oils, or maybe some of the nano silvers, which they're going to have some here this weekend that you can talk to. You might want to try just using probiotics and see what kind of a difference that makes, because it's the body then triggering its own natural way of dealing with it. Or you could get creative and use things like neem, or the thieves oil, which people who are into oils love thieves. Grapefruit seed extract is really good, especially for something like the trichomonad, because it's good for parasites. So this is me. This is what I feel like. I feel like I'm looking in somebody's mouth and all I'm thinking about are the different organs, each tooth being related to a different organ in the body. You guys have dental meridian charts there. How I came up with that dental meridian chart, my thesis work, the first time I got a PhD, was on the relationship of the odontons to the body. So the tooth-body connection. And I went through every chart that was available. Dr. Voll had charts. There were charts from Germany. There were charts from acupuncturists. There were charts from massage therapists. I put everybody's charts together. There were some errors in some charts, just in typos. Took all of that out, and I still couldn't memorize it. And I happened to be in an acupuncturist's office, and he was trying to explain to me that this tooth is related to the breast, and this tooth related to the thyroid, and it makes a cricus on the face. And I said, wow, I didn't get what you said. Could you say it again? And so he said it again, and I tried desperately to write it phonetically and still couldn't understand what he was saying. And so one day I decided, you know, my son is challenged. The way that he learns things is very visual. I would always put things in colors for him and code things. So I decided to color code the dental chart. And when I did that, I saw that the maxillary molars relate to the mandibular bicuspids, and vice versa. The maxillary bicuspids relate to the mandibular molars. It makes a crisscross on the face. And that was the first time that I understood that. So the only way I could memorize it for myself was putting in that color coded. So you'll see that, and I just randomly picked colors. You know, all the anterior teeth have to do with kidney and bladder, so it made sense to me that they would be in yellow, because that's the color urine's supposed to be. And then I just picked pretty colors from there, so everything else is just arbitrary from there on. Chiropractors get that different areas in the back relate to different organs. And so if you've been to a chiropractor before, you've been exposed to that. Acupuncturists get it, because if you go in with a headache, you're probably going to get a needle in your toe, because usually it's a liver that would govern that. It's all the rest of us that have a hard time buying into that. Although we have been told through time that certain teeth were related to the eye teeth. I give my eye tooth for that. They're really, the cuspids are related to the eye. They're also related to the liver. But you've got teeth that are related to the breast. You've got teeth that are related to the heart. Even if there's not a tooth there, it can still be related to that particular area. So you're going to be able to cross-reference things on the charts. These are some of the old charts of things that I found through the years. And that's the chart that I was talking about. That's the color-coded one that you should have. When I was doing my research the first time, oddly enough, I had an incredible number of men that were coming in with elevated PSAs. And when I would go through realize that in the beginning, all I was doing was data collection. You would fill out a questionnaire telling me what your health problem was. I would look at a Panorex that you had taken, document any dental issues that were there, and then collate all the data. So I had all these men that were coming in with elevated PSAs that either had a root canal on an anterior tooth, maxillary or mandibular, or the tooth was not there, or it was a dead tooth. It had done its own root canal. Maybe it was traumatized in some way and it was just a non-vital tooth. And so I had this stack of information on men with prostate issues that tightly correlated with teeth. In the meantime, Dr. Rao was doing research in his clinic on women with breast cancer. And this is the reason I got into thermography, because he found that 98% of women that have breast cancer have a root canal on the tooth related to the breast on the same side as their offending cancer. And that was pretty powerful. And so I started doing thermography, and now when you get thermography in my office, you get pictures of your head and your neck, and I want to know everything about your dental. And I get referrals from physicians all over the place who want their patients to have that kind of documentation and information early enough so that if something's showing up here and we've got something showing up on a tooth as well, that they have an opportunity to have it taken care of. Now realize this is not new information. Look at this. Dr. Price found out that the root canals were deadly in 1925. Wow, almost 100 years ago. And yet this is still new information to a lot of us. So I use EAV in my office as well, which is electroacupuncture according to Vole. You know, you can use something to pulp test a tooth, and that gives you some information. This is not like that at all. This is using the meridians, which are invisible, not imaginary. Here in the United States, we think that they're imaginary. They don't exist. And you take readings off of acupuncture points and while the person is touching each of the different teeth, and you're able to then look at the information about how much electricity can go through there. And most of that information is in the book on how to do that. Actually, in the book, it'll tell you even not only how to work the EAV equipment to get your information about dentistry, but how to do muscle testing. So those of you that do applied kinesiology, hopefully it will be helpful for you there as well. Let the tooth be known. You should have a, yeah. And so, you know, it's in Asia that we can thank them for acupuncture at all. But it wasn't until 1996 that we confirmed that it works. When we look at acupuncture here in the United States, again, things that are invisible or just imaginary. And so we have Dr. Kim Bon Han that we can thank for him injecting a radioisotope into an acupuncture point and then imaging it to show that it didn't go up an artery or a nerve, it didn't go up a vein, it went up the meridian. And so we were able to document it. Oh, and that's a picture of it. And then you have Dr. Tiller, another name that you need to know. Dr. Tiller is still alive, although he is very old. And if you read any of his books, they start off, they're very dry, very technical, and very eclectic. If you can imagine that all rolled into one book. They are out there. But he is past president of the Materials Department, Science Department of Stanford University, and he set out to disprove that EAV was possible. He said, that's ridiculous. Your resistivity on your skin should be the same all over your body. And when he started doing his testing, he found out that it was actually different on the different acupuncture points. And so he confirmed that the science itself works. Dr. Vole is the physician in Germany that actually developed the technology. He started learning a lot about acupuncture and said, wow, this is really cool, but I don't understand. You're supposed to use a gold needle when you want to stimulate an area, and you're supposed to use a silver needle when you want to depress it. I don't know whether it needs to be stimulated or depressed. How do I find out? And of course, the Chinese were doing pulse testing, so they could determine what it needed. He didn't know how to do that. And a friend of his that was into electric stuff said, well, why don't we use some kind of basic ohm meter and kind of touch the skin and figure out? And so he found out that true, if the reading was too high, then they could use the silver needles and bring it back down. And if the reading was too low, they could use a gold needle to stimulate it. So that's kind of how the technology developed. It is repeatable. It's not biofeedback. There are pieces of equipment that are out there that you put your hand in that is biofeedback. That's different. It's not repeatable. The equipment that I'm talking about is something that is so precise that you can use it in surgery, which is what we do. When a tooth is taken out or when a cavitation is cleaned out, we're actually there documenting when the flow of energy reconnects again. So we know when all the dead tissue is gone. You cannot do that with biofeedback. And if you talk to me later, I'll do more about explaining to you why. So yes, your body is electric, so I do expect that you buy into it because most of you have seen an EKG or an EEG, but I can imagine what it would be like to be in a physician's office about the time frame that EKGs were first coming out. The salesman comes into your office and says, look, dude, if you put a sticky pad here and a sticky pad here and one here and you connect these leads up to it and you turn it on, you're going to be able to tell what the heart's doing. I'm sure that just seems so foreign for them, but that is now diagnostic, and we have 12 lead EKG that's used, and the first thing you get when you have chest pain is a 12 lead EKG. So I don't want you to be afraid of the technology. Another way of testing is muscle testing, and this, I also remember the first time I ever got muscle tested, and I thought, oh, this is really voodoo. This is really out there. I don't know if I can buy into that. And I still have my moments when I see people doing muscle testing where I'm going, I don't know. I don't know how good their skills are. But I have seen people do muscle testing and be spot on for glucose blood sugar, where they're muscle testing the person and they're talking to themselves while they're trying to push their arm down, and they're going 85, 86, 84, 85, 85, 85. Okay, go ahead. Take your blood sugar, and it's 85. Now that's pretty doggone cool. There's a lot of things that happen in this world that I can't explain. I can't even tell you how my cell phone works. I don't understand where emails go in cyberspace. So there's a lot of things that I use, but I don't understand, and I'm okay with that. Muscle testing I don't do, but people who do that are really good at it, if you develop a relationship with them as a practitioner that you're comfortable sending to, I wouldn't have a problem with that. So we're going to talk about the teeth and the thermography. I already told you that I do more pictures when I do a breast study because I'm trying to correlate different data with the what's going on in the mouth and breast. The colors on the thermography, has everybody heard of thermography before? It's a heat-seeking camera that's used. The patient disrobes in a room. There's nothing that touches them. There's no squishing. You know, as I explain a mammogram to a woman, that you walk up to a giant clamp and they're going to clamp down the front of your breast. Well, what about this part? I have breast tissue right here. Nobody looks at that because they can't get it in the machine, so it's magically not important. And then if your breast is too dense, I'm sorry, we couldn't see anything, even though we took the image 3 times. So we're going to have to send you over to ultrasound. We'll try again next year. When you're doing thermography, the beauty is you're looking at, as a screening tool, using the thermography, which that's all a mammogram is a screening tool. Neither of them tell you have cancerous cells. You're looking for inflammation. So I'm able to look at inflammation and look at the lymphatics, look at the muscles, look at the breast tissue, look at the lymphs under the breast tissue, look at the back, look at the neck, look at the face, look at the sinuses. I get a ton of information. In this case, though, we're not looking so much at hot spots. You see on these bottom pictures, I have a lot of red. That means that there's more inflammation in those areas. But look at those top pictures. That person has a problem also. Their hands are too cold. That's indicative of either Raynaud's, which is an autoimmune, or the person has horrible hormone problems, or they have very high levels of heavy metals, or they've got blood sugar issues. I don't know which. It's a screening tool. So it's going to help me ask more questions and gather more data. If you're using thermography, though, and you had an abscess like you see over here on the right, or what you see on the x-ray here, you're going to imagine that it's going to show up warmer on the thermography. So here is a thermography just of somebody's head, and I tried to put my readings for my EAV in the center, and then I dropped her pano down here. This is a woman that has diagnosed breast cancer of the left breast. Can you see the red area and how it's going down this way? That is usually what we find when there's a dental focus that has a link with the breast. You see that really tight connection. Okay, you look at this lady, and here you see a full frontal picture, and then I've got a picture of her right side versus her left side. That's the sequencing that it goes through in here. Do you see that when you're looking at the right side, it's more blue? And then you see over on the left side, you've got this red area. Now, we don't know where there's a problem yet. We just see that there's a difference from one side to the other. Actually, by the time you look at the x-ray, you're better in tune with what's going on, and you see that that root canal tooth, which she has no awareness of. She doesn't know she has a root canal. She has no sensation there, but has reabscessed. And so that's the inflammation that's showing up on that side. Sometimes it's actually the blue areas that are a problem because our cavitations are avascular. Sometimes that's the issue. Here again is looking at EAV, which is just one of our tools for being able to tell a dentist where they're going to be working. You know, if a dentist is getting into a place where they understand that root canals can be a burden to the person's health, not every root canal tooth is going to be a burden. Not every root canal tooth is going to need to be taken out. So you're going to have someone help guide you about how that is affecting the body. I always suggest homeopathic remedies for x-ray. This is another thing that sets your office separate from a traditional office. It is a necessary evil to use x-ray. You cannot diagnose to the best of your ability without taking x-rays. I just don't know another way. Yes, there are some great tools out there like Canary, but it doesn't look at interproximal. And so when the patient comes in and says, no, I don't want an x-ray, I always explain to them, look, you get x-rays all day long. I appreciate the fact that you are keeping up with it because nobody is other than you. And it is accumulative. But I do have a homeopathic remedy that I can help offer you today that will help negate the exposure for today. And it's great for other things, like when you're flying. So you take a couple pellets after the exposure. So I completely understand that there's a lot of you out there that don't understand homeopathy. Homeopathy is used more in Europe than it is here in the United States. You're looking at frequency medicine. You're looking at something that elicits a response. So things like, if my husband and I walk in a restaurant and they are playing our favorite song, you and your wife walk in, or your spouse, walk into the restaurant with us, and you don't even hear that music is being played. But Toby and I lean over to each other and we give each other a peck on the cheek. It elicited a response for us. That's frequency medicine. So when you find the right remedy for something, it works spot on. In this case, we're looking at trying to cancel something out. So in homeopathy, like cures like, if you have an allergy to ragweed, what do you think you get injections of? Very small doses of ragweed. If you want to induce vomiting, you ever hear of supra ipecac? It's the coolest stuff ever. Give it to a kid with a can of soda and stick them in the shower afterwards, because they're going to have projectile vomiting. Don't do that to anybody. That's mean. But if you had vomiting that you could not stop, you would use a homeopathic remedy of ipecac. So it's a different mindset than what you are traditionally trained for right now. So you just have to bear with me until you really learn more about it. So what we're going to pretend is that this is how I explain it to a patient. You're a motorboat and you weigh about 400 pounds and you're going 40 miles an hour in a particular direction. You are going to create a wake behind you that's unique for how fast you're going and how much you weigh. If I could find a motorboat that weighed the very same thing, coming in the opposite direction, going the very same speed, where our wakes come together, they will cancel each other out. Can you visualize that? Okay, so what I'm trying to do is cancel out the fact that I just received x-ray. And they're going to ask you, what is this? It's x-ray at 30C, which is a dose. It's a dose of the frequency. And most of them, I do have a little things typed out for patients that are just really, I don't want to take it unless I know what it is. Great. Here, read this. I'm just offering it for you. If you don't have to take it, it's not mandatory. But the girls in the office know now that every patient gets a lead apron and every patient gets a homeopathic remedy. And so I'm just, there's a couple companies out there that have it, but the dose that you will want is 30C. So dentistry can be toxic. And now I'm going to turn it over to our next Vice President, Marion Sayward.